Thrombocytopenia, a common condition encountered in veterinary hospitals, is characterized by a dangerously low number of platelets in the bloodstream. Platelets are essential blood components that play a critical role in forming blood clots and preventing excessive bleeding. When platelet counts are severely reduced, dogs are at risk of spontaneous hemorrhage, which can lead to significant complications and increased healthcare costs due to the need for blood product administration. Currently, the primary treatment to protect against spontaneous bleeding in dogs with low platelet counts is the administration of platelets through blood transfusions. However, this study explores whether an alternative treatment, epsilon aminocaproic acid, could help these patients by reducing their need for blood transfusions and improving their overall outcome. Epsilon aminocaproic acid, along with another medication called tranexamic acid, belongs to a class of drugs known as antifibrinolytic agents. These medications work by inhibiting the breakdown of blood clots. They achieve this by binding to specific sites on a protein called plasminogen, which prevents plasmin, an enzyme responsible for dissolving clots, from attaching to fibrin, the main structural component of a blood clot. In human medicine, antifibrinolytics are used in various situations involving excessive bleeding, such as during acute trauma, after childbirth, and during surgery. In veterinary medicine, there has been growing interest in using antifibrinolytics as an additional treatment for bleeding from various causes, including bleeding associated with low platelet counts. Several factors contribute to this interest, including their relatively low cost, a perceived low risk of adverse effects, and the limited availability of rapid tests to detect excessive clot breakdown, also known as hyperfibrinolysis. One of the reasons for considering antifibrinolytics in patients with low platelet counts is the hypothesis that there might be an imbalance in the process of clot formation and breakdown, with a potential for increased clot breakdown due to a lack of substances normally released by platelets that inhibit this process. Additionally, dogs with severe hemorrhage might develop a more widespread condition of excessive clot breakdown. To investigate this, the researchers used the tissue plasminogen activator spiked rapid thromboelastography test. They found that only one dog showed mild evidence of excessive clot breakdown at the beginning of the study, and this resolved after treatment with epsilon aminocaproic acid. This finding did not appear to be clinically significant in this particular dog. The generally normal clot breakdown profiles observed in these dogs might explain why the prophylactic treatment with epsilon aminocaproic acid did not show a significant clinical benefit. These findings are similar to those in human studies of thrombocytopenic patients with blood cancers, where excessive clot breakdown was also not commonly found. This suggests that systemic excessive clot breakdown may not be a primary factor contributing to hemorrhage in patients with low platelet counts.